Season's greeting. This is Dr. Saravanan, Professor and Principal, Sri Bhartimaya College of Physiotherapy, Veer Narmad, South Gujarat University, Surat, Gujarat, India. I'm here to present my research presentation, Physical Activity Levels, Barriers and Facilitators to Physical Activity among Physiotherapy Students. Physiotherapists in general play a vital role in promoting physical activity. Physiotherapy students are emerging physiotherapists in future who will be handling patients and population with physical inactivity and or the results of physical inactivity. So it is not clear in any individual what are the most common barriers and facilitators to physical activity which can motivate them, which can engage them in these physical activities. So understanding these physical activity levels which physiotherapy students are going to promote in future and identifying the facilitators which can motivate them to engage themselves in physical activity and in turn the patient population in physical activity, and also identifying the barriers which might be preventing them from participating in physical activities becomes very crucial and essential. So some of the common examples from previous studies which had studied the perceived barriers on physical activity included lack of time, lack of resources, lack of motivation, lack of manpower, lack of social support, etc. Similarly, some of the facilitators were support from the family and friends, support from society, etc. However, there are very few studies available in around the globe where these factors have been tried and identified and have been implemented. Unfortunately, from this part of the country, we don't have any such studies, especially on physiotherapy students, as we believe that physiotherapy students are the future emerging physical activity promoters to the population and to the society. This study is crucial for two main reasons. Firstly, as mentioned earlier, being healthcare professionals in future, physiotherapy students play a pivotal role in promoting physical activity, and hence understanding the factors that influence or affect act as a barrier to physical activity needs to be identified. Secondly, they are a unique population, these physio students, often facing unique challenges in their own student life because they have long study hours and demands of clinical placements, which does not allow them to engage themselves in physical activity. So, therefore, understanding the perceived barrier and the physical activity promoters, the facilitators, plays a crucial role. And to understand that, we have conducted this particular study. The primary aim and objective of this study is to determine the levels of physical activity among physiotherapy students, to identify the perceived barriers, what they feel as barriers to physical activity, and the facilitators which promote them to perform physical activity in their life. Secondary objective is to identify the correlation or association relationship between selected demographic variables and their physical activity levels. After extensive review of literature, we found that there are a few standardized outcome measures which are essential to identify the barriers of physical activity, the facilitators for physical activity, and of course the physical activity levels. Based on the extensive review of literature, the International Physical Activity Questionnaire was taken for identifying the physical activity levels of the participants. The barriers to being active quiz was taken for identifying the barriers, the perceived barriers of physical activity. And the physical activity facilitator questionnaire was taken to identify the facilitators that can promote physical activity. This cross-sectional study design included third and fourth year undergraduate physiotherapy students and first and second year postgraduate physiotherapy students from South Gujarat region. Practicing physiotherapists, the first and second year undergraduate physiotherapy students are excluded from the study as we believe that the physical activity levels are considering only the students who are involved in this. So before conducting the study, a pilot test was performed on 15 physiotherapy postgraduate students to identify the reliability and validity of the questionnaire that is being used. Prior permission was obtained from all the head of the institutions where the study was conducted. An informed consent form was written. Informed consent form was given to the participants so that they voluntarily participate in the study. And data collection was obtained by using a reliability tested questionnaire, which consisted of four parts. The first part of the questionnaire included the demographic variables of the participants, like their name, age, occupation, which year they study, do they have any medical condition which prevents them from involving in physical activity, etc. Second part of the questionnaire assess the physical activity level of the participants using the International Physical Activity Questionnaire, and the data was collected in the units of MET per week, that is metabolic equivalent per week. The third part of the questionnaire included physical activity facilitator questionnaire as designed by Udanaya, which aimed to identify the facilitators which are promoting physical activity. And the final part of the questionnaire included the barriers questionnaire, that is barriers to being active quiz, which identified the perceived barriers, what these participants feel as barriers to their physical activity. Data collection was conducted after explaining the study in detail to the participants and requesting them to fill the questionnaire as much as possible. Once the questionnaire was completed, the completeness of the questionnaire was checked by the assessors, and if it is incomplete, it was excluded from the study. And all the completed questionnaires were the data was entered using statistical analysis software SPSS version 23. So descriptive statistics of mean and standard deviation were used to identify the physical activity levels, the barriers to physical activity, the facilitators of physical activity, and as per the secondary objectives, Pearson correlation coefficient testing was used to identify the relationship between selected variables and the physical activity levels. To associate the categorical variables, relationship between the categorical variables, chi-square analysis was used. All data were analyzed using SPSS version 23 with a confidence interval of 95% and p-value less than or equal to 0.05. We had a total of 450 students who volunteered to be part of the study, which included undergraduate and postgraduate students. The gender distribution was 88% of females and 12% of male. The mean age of participants was 21 with a standard deviation of 1.28, which was measured in years. The height, the mean was 160 with a standard deviation of almost 8, measured in centimeters. And the mean of weight was 56 with a standard deviation of 12, measured in kg. The category of BMI distribution was almost 21 percentage of participants were underweight, 42 percentage of participants belonged to the normal category, and 18 percentage were overweight. We did not have any obese participants in the study. The mean metabolic equivalent, that is physical activity levels, according to this particular study, was found to be 2,373, and the total barrier score was 25, indicating that there was moderate barrier to physical activity. The overall score for perceived facilitator of physical activity was close to 30. Among the subscales of the barriers, lack of energy and lack of willpower was found to be the most common barriers, with lack of energy with a mean of 5.25 and lack of willpower close to 5.1. A weak positive correlation was observed between the body mass index and the facilitators of physical activity with a R value of 0.131. And there was also a weak positive correlation between metabolic equivalent and the facilitators of physical activity with a Pearson R value of 0.156. There was statistically significant association observed between gender and the metabolic physical activity level category with chi-square of 6, and between gender and lack of willpower with a chi-square of 14. There was also significant association observed between the body mass index and social influence among the physical facilitators, which with a chi-square of 8.2, and body mass index and lack of resources as a barrier with a chi-square of 8.1. So the mean metabolic equivalent as observed in the study shows that the participants were moderately physically active, which was higher in fact as compared to studies by NSINCO, where the range of metabolic equivalent was found to be 840 to 4,200, whereas this study showed a mean of 2,343. Similar studies by Eneth Herazo Beltran and NSINCO suggested that lack of motivation and time being the most common barriers, which was in contrast to this particular study, where these two were not found to be the most common barriers. Physiotherapy students have identified fear of injury and lack of skill as the least common barriers for physical activity, according to them, which suggests that being physiotherapists, these young participants were confident in using their learned skills and prevent injury related to physical activity. That is an indirect association what we have found out from the results of the study. Based on the above observations, it can be concluded that physiotherapy students from South Gujarat region are moderately physically active. Results also indicate that the most common barriers perceived by these physiotherapy students are mostly internal as compared to external, which means there is a need to educate, encourage, and motivate the physiotherapy students to remain physically active, which in turn would be carried forward to the patient population in future whom they are going to manage. Health education programs regarding exercise and physical activity can be organized where the facilitators and barriers can be discussed. Based on these findings, further study can focus on identifying the effects of the health education programs or the motivating webinars or seminars conducted to physiotherapy students regarding the importance of physical activity and how that can be carried forward to the future population. Thank you so much for this wonderful opportunity of presenting my paper on this particular conference. Thank you.